Now we're going to have a look at the Faber test, which is actually quite difficult to explain. So Daniel, if I can ask you to bend up your left knee and put your foot across your knee, other knee, that's it. And now just take your hand and push down on your knee. Great, and relax. And so this test, flexion, abduction, external rotation, will tend to stress the sacroiliac joint. And Paul and I are both also pelvic trauma surgeons. And so we can investigate patients with sacroiliac joint pathology, and very rarely they require a sacroiliac joint fusion. And so one of the first indicators is the pain around the hip actually localized to the sacroiliac joint, and so that's useful. Now, if this test actually gives patients pain in the front of the hip, that's more likely to be an indicator of labral pathology. And labral pathology is notoriously difficult to diagnose. Thank you, Daniel. If you can come and have a seat over on the chest. With labral pathology, examining the patient face to face and putting the patient into extreme positions to stress the labrum is really key. And that's quite difficult to replicate in a video consultation. And in terms of making a diagnosis, the imaging, MRI or MR arthrogram, are notoriously unreliable with very high false positive and false negative rates. So I suppose that's one area where seeing the patient face to face is really useful. So Armin, there's no particular questions or comments at the moment?
There is one that's come through. It's more of a case, but I'll just read it out to you. So one of our GPs had a patient with pain in the lower back and wobbly on feet, prostatic CA, weak dorsiflexion on foot on video, referred to neuro. What's your thoughts?
Yes, exactly the right thing to do. I think you lose some of the subtle cues that you pick up with face-to-face are much more difficult on video consultation. And so there are some really clear pointers there that this could be, it could be spinal cord compression, especially if the patient has a hypertonic gait. And so a rapid referral so the patient can be investigated and treated appropriately. Firstly, it's very reassuring for the patient if actually there isn't anything serious. And secondly, obviously, if there is, they can have prompt treatment. So I completely agree. I would do exactly the same in that situation.